Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Have you ever heard of cosmetic acupuncture? Or maybe you've heard of the acupuncture facelift. Holistic practitioners throughout the country are performing these procedures, and they claim to get pretty impressive results. Well, we know that acupuncture works to lessen pain, reduce stress, and improve the body's healing mechanisms. But can it also be used to smooth wrinkles and firm the skin? And if so, how does it work, and what results can you expect to get from it? Well, in this episode of the Holistic Plastic Surgery Show, I'm joined by a leading expert in cosmetic acupuncture. We'll reveal the truth behind these procedures, whether they are worthwhile for you to consider, and what you can expect to get from an acupuncture facelift. So let's get started. My guest this week is a naturopathic physician and a licensed acupuncturist. She also specializes in natural hormone balance and thyroid issues by taking a whole systems approach to optimal health. Her private practice, Lakeside Holistic, is located in Coeur d'Alene, Idaho, and Liberty Lake, Washington. I'd like to welcome my good friend, Dr. Pamela Langenderfer, to the Holistic Plastic Surgery Show. Thank you so much for coming on the Holistic Plastic Surgery Show. I'm really excited to talk to you, Dr. Pam, about this exciting treatment that I think a lot of people don't know a whole lot about, but may be interested in hearing about it.
Yeah, cosmetic acupuncture has actually been around for quite a long time, and actually first became popular here in the West, I think in the 1980s, where Time magazine actually published an article about it. And it's been kind of seen a resurgence over the past 10 years or so of having more practitioners offer this in their practice.
So how did you get involved with performing cosmetic acupuncture? How does somebody actually train in doing this? Because it's not like they teach this at colleges and universities across the country.
Yeah. No, I had went and did some specialized training actually with a couple different people, probably over 10 years ago now, because I was looking for a way to enhance beauty. And with me being a naturopath and an acupuncturist, I'm always looking for more natural ways to do that. How can we stop the clock? How can we enhance what we have? And the cosmetic acupuncture was something that just fit in with what I believed in.
So then you finished your naturopathic training. Did you start your practice before you actually did training in cosmetic acupuncture, or was this part of the actual training when you initially started doing it?
No, I actually did the cosmetic training after I'd been in practice for a couple of years. Mm-hmm. So I did my naturopathic degree and my Chinese medicine degree at the same time. And then I was in practice probably for about 2 years or so when I started pursuing more treatment or more training in the cosmetic acupuncture.
And were you trained here in the United States, or did you go out to China, out to Asia to have the training?
I was actually trained here in the United States from 2 different practitioners. So I've learned 2 different techniques and incorporate a little bit of each technique into my treatment.
Yeah, it's funny because, acupuncture, when we look at alternative medicine, and there are a lot of physicians, a lot of allopathic physicians who've been trained like myself that kind of poo-poo these ideas of a lot of these other types of treatments like energy healing and biofield and all this stuff, yet acupuncture is something that's been around so long, and studies have even shown that it works. It really does. We just can't scientifically explain why it does. So I'd like to go into kind of that, how this works in a little bit. But let's start by talking about just walking through a person going through the procedure. So somebody walks into your office and they say, look, I don't want Botox. I don't want filler. I'm using natural products on my skin, but I'd like to get a bit more rejuvenation. I'm interested in cosmetic acupuncture. What is the treatment and the procedure like for them once they walk in the office and they meet with you, and I guess then they go to your acupuncture room, or how does that work?
Yeah, so what I usually do is we do an initial consultation because we go through everything. We'll actually look at the person's diet. We look at other supplements that they're taking because actually that all plays a role in our treatment. And when we determine what we're going to do and how we're going to move forward, they'll actually wash their face first, and then they step into the room, and then we put acupuncture needles, actually not just on the face, even on the hands, the legs, sometimes the stomach. And then at the end, we usually end it with some sort of natural type of moisturizer on their face. And we also use something called jade rollers, which are actually rollers made out of jade, which are really cooling to the skin as well. And it can really help to calm down any inflammation in the area.
So then, do you have like soothing music that's playing while this is happening?
Yeah, we do. So when we're doing acupuncture treatments in general, we always have some music playing. The room is very dark. I usually put some essential oils in the room. So people usually like to have lavender is a very popular one. And essentially people just go to sleep. Usually they lay for about 30 minutes or so and they take a nap, and they just lay there and get into a very relaxed state.
So now, as a plastic surgeon, and in my office we do injections all day. I've got 3 injectors that are doing it. I do it myself. The thought of having needles poked into me and falling asleep while that's happening is just it just doesn't make a lot of sense. It's like somebody's punching you in the face, yet you fall asleep. Like, so I mean, when I inject people with needles, and we use the tiniest needles to inject Botox, they're 30 gauge needles. It's still, I mean, it's not fun. Like, they still feel it. Sometimes we use ice and we'll use topical numbing medicine. Sometimes we have this little vibrating machine that can kind of confuse the nerves to make it so that they don't feel it. How is it that this is actually a relaxing treatment? Can you explain how that, I mean, because it as a surgeon, it makes no sense to me that you're poking somebody, and how many needles goes into, let's say, a typical face?
Yeah. So some people, when you put the needles in, they do sometimes feel a little bit of a zing. It kind of feels a little bit like a poke, and then other times people don't feel much at all. But the difference between my needles and your needles is that your needles are actually injecting something, so they're hollow on the inside. My needles are actually smaller than yours. They're kind of like a hair, and they're very thin, and they're actually very flexible. So that's probably the biggest difference in why they don't hurt as much. And then once you put them in, if there is any type of pinch or sting, it actually goes away usually within about 10 to 15 seconds. So that's the biggest difference with that, is more of the type of needle that we're using. Because I probably wouldn't want your needles in my face either to lay there and go.
So you don't ever need to have numbing medicine or say, hey, ice your face before?
Oh, no. We never do anything like that on the face at all. And the needles that we're putting in, as I mentioned, they're very fine, and we use different types of needles. There are actually certain brands that actually are much nicer. Usually the Japanese brands are actually a little bit easier to insert, and people don't feel them as much. And we could have anywhere from maybe like 10 or 15 needles just on the face. Part of that depends on what we're treating. If we're trying to treat things around the eyes or the forehead, the variation will vary on that. And then we also have needles that are very small that I actually have to use tweezers to hang on to, and I thread it under the lines. And those don't really have much feeling at all to them.
Mm-hmm. So you go anywhere from 10 to 15. I've heard some practitioners tell me they do up to 30 in the face, I guess, depending. Is it that people who have worse aging and more wrinkles, you got to put more needles in?
Yeah, that's part of it, is depending on what area you're treating, and I guess how much work they need to be done. But again, kind of looking at the whole person, if you actually have somebody that has a history of headaches, and if you put like 30 needles in their face and they have a history of headaches, you can actually cause the headache to happen. So some of it depends on the other things that they have going on, because if you do too many of them, it brings so much blood flow to the upper area that it will exacerbate some symptoms. So you do have to be careful with it.
So after you did your training in this, how long did it take for you to feel comfortable with what you're doing? Because, let's say with Botox injections, we have a very, it's a reproducible kind of a grid where somebody who's new at it could kind of do the same thing on everybody and get probably a pretty reasonable result. Now in my office, where obviously we tailor it now, obviously as we have so much experience with it. With something like cosmetic acupuncture, how much of it is more of an art form that you look at the face and you examine the face and you examine their issues versus we kind of do the same thing on everybody?
Well, part of it, I think, is just having the Chinese medicine training is that I feel like you can't approach anything until you look at the whole person. So that's part of the art form that I think it's developed over the years. And with any new procedure, when I bring it into my office, I'm kind of that practitioner. Well, I'll have a handful of patients and say, hey, I just learned this. Do you want to come in and I can practice on you? And so I actually did that with probably about 10 people for about 2 months before I started offering it to everybody. And then once we saw that we were getting results and they could see improvement with it, then I actually felt comfortable bringing it to the rest of my patients.
So how long does a treatment last, and how many treatments does somebody need to undergo to start seeing results?
So typically a treatment will last about an hour. Usually the needles are in anywhere from 30 to 40 minutes or so. And you do need to do it twice a week for a minimum of 6 weeks. So at least 12 treatments are needed. If people do closer to about 20 or 24 treatments, they're going to see better results that will stay longer. But a minimum of 12 treatments, and it really takes until probably about treatment 8 or 9 before you could say you're starting to see a difference there. And then there are a variety of things that can impact how well the treatment is working. And so this is where like diet is so critical, because if I have somebody that has a really poor diet, they're honestly not going to get as good of results because I'm fighting against some chronic inflammation in the body.
So what type of results then do people get? So if somebody comes in and they say, I've got crow's feet wrinkles, I've got, frown lines and things like that, or I've got age spots, or I've got drooping skin. Realistically, what can you tell them that they can expect from this treatment?
So the treatment will make you look about 5 to 10 years younger. So essentially it makes it look like you're refreshed. You've had a good night's sleep. What's different compared to what you do is that I really try to emphasize to people, this is not surgery. So if you're looking to fix something that maybe you don't like the shape of your nose or, where something is at, it's not going to fix that at all. But what it's going to do is it can help to tighten the skin. It can help to reduce blemishes. It can really help with rosacea. You can definitely see more blood flow happen in the face. And so people have just a brighter appearance to them. And then it actually can help if their eyes are drooping a little bit or even around the jaw or the neck. It can actually help to tighten it up. And part of that happens because when we're putting the needles in, we go in and we're stimulating some of the muscles in those areas. So sometimes I think of it as like a little bit of a lazy workout for the face, right? We're going in and we're trying to get those muscles to wake up and working again.
How deep do the needles go? Do they go all the way through the dermis, through the deeper layer of skin, into the subcutaneous tissue, or even into the muscle then?
It depends where I'm at. So different parts of the face, you can go a little bit deeper. So if I'm in a little bit fleshier area, I can go in a little bit further. But when I'm on the forehead, I'm not going straight in. I'm actually thinning, or I'm taking the needle and I'm weaving it under those lines that are there.
Okay, so let's kind of get to the nitty gritty here. Two things. The first thing is, how much does it cost per treatment?
So cosmetic acupuncture could range anywhere from about $100 to $150. That really depends on what part of the country you're in. And sometimes practitioners will sell it as a package, but you could say if the person is including some sort of maybe facial as a part of that regimen, which some people do, you're going to probably pay a little bit higher prices. And then I've also seen people where they just do it more as just straight acupuncture where they're not doing anything else and that's all they're doing. And those treatments could maybe range around $80 or so.
Now, is this something that you do yourself, or do you have somebody at your office, one of your couple offices that is your assistant and kind of does this for you?
No, the acupuncturist will always do the needling. So you can't do the needling unless you're an acupuncturist, but they may have an assistant that might help with some of the facial part of it, or if they're doing any type of moisturizers and creams on the face, the assistant might come in and help to finish that up.
So her name is Dr. Pam Langenderfer. She has private practices in Coeur d'Alene,
Idaho, yep.
Idaho, and Liberty Lake, Washington. And if you're interested, she does a lot of. She's a naturopathic physician. Acupuncture and cosmetic acupuncture is just one part of her practice. But go to thehormonalcode.com, thehormonalcode.com, all one word. And this is basically a website that you can go to where she'll give you some free tips on how to live a healthier life in today's toxic world. So I'll give you that link at the end of the show as well. But just to kind of get you started getting to know her a bit better, this is a great website, thehormonalcode.com, to start at. So let's talk now about exactly how this works. So we've talked about the procedure. It's obviously very unlike anything that we do. I mean, I use a lot of needles, but not in this way. Mm-hmm. Why do you think, and how do you think this actually works?
Well, I think we have two different explanations here. So if you look at the Chinese medicine explanation, in Chinese medicine, I always think of Chinese medicine as like an art form. And I always think back to when I was in school and I would go into my Chinese practice or my Chinese medicine classes. It was like I was in art class and you're randomly throwing things up on this painting. And then at the end, you see the product. And then I would go to one of my Western medical classes and we're looking at biochemistry and physiology and you're just following these pathways. So in Chinese medicine, the human body is a microcosm of our macrocosm, our greater environment. And I always tell people, 2,000 years ago, they didn't understand anatomy and physiology, but what they understood was nature, and they apply those same principles of nature to the body. So for example, in Chinese medicine, we're always looking at the person's tongue, and we're looking at the color and the coat of that. We're checking the pulses. We look at their whole symptom picture, because you could have somebody come in with fatigue, and you could have 5 different people, and it's due to 5 different reasons and 5 different Chinese diagnoses or different diagnoses. So what we're trying to figure out is what that person's underlying issue is. And so a good example of this is that if you have somebody that comes in and I take a look at their tongue and it's very red, and maybe their skin is really dry and they have a little bit of rosacea, we're going to give them a diagnosis of heat. They're really hot. And if this person eats a lot of garlic and spicy food, it's actually going to make them worse, and it's going to make their skin worse. And so it's all about balance. We're trying to use herbs that are cooling. We choose acupuncture points that are cooling. And everything in Chinese medicine is based on this concept of qi. And essentially, qi is energy, and you can think of it as blood flow. And in Western terms, that's how I usually think about it, as when we're stimulating qi, we're stimulating more blood flow to an area. And when you do that, you bring more white blood cells in, and then when you're using different points on the face, it can actually help to stimulate collagen and elastin in those areas. So either way you look at it, some people like more of the Chinese explanation because it's more of an art form, and then you have the Western explanation that kind of gets into the science of it.
And my understanding with the whole idea of acupuncture then is you've got kind of these 12 meridians that go through the body, and these are the energy that flows through your body in these kind of 12 different pathways. And so, I mean, isn't the belief that you stick one of the acupuncture needles in, you go, right next to one of those, and you change where the pathway goes, and by changing where that energy flow goes, you may change then the person's health or wellness, and that's kind of how it's believed to work. Is that pretty accurate? Or I'm not a Chinese medicine doctor, but
you're on track. You're on the right track. I think, yes, there's the meridians, and a better way to think about it is that on those meridians you have specific acupuncture points, and so when there's an imbalance, there's a blockage in the meridian. So it's not that the meridian gets rerouted, so to say. It's just more like you have a river and you have a dam, and we're removing the dam and we're getting that river flowing again. And so we're removing any blockages that might be in the area.
Are these types of meridians things that you map out, that you say, oh, okay, the meridian, let's say, on the face is a half a centimeter from the tip of the nose or something like that? I mean, are these, when you study it, actually mapped out specifically, or is it more of kind of an idea that you feel where it is at?
No, it's mapped out. You measure, like usually you use your fingers to measure, and it's measured in what are called suns. So, so that's when I'm going around and figuring out where the acupuncture points are. I'm always using my fingers to measure exactly like how far from the nose over to here. And a lot of times on different areas on the body, like on the leg, when you're going down the meridian, you can feel where the points are, because it kind of feels like a little divot in there, and you can go, oh, there it is. And then a lot of times if the person needs it, it's really sore in that area.
And do you think then when you put the needle in, do you know, based off how the patient feels, whether they feel the poke or they don't, whether you're in the right spot? Does that make any difference?
Sometimes it does. I mean, sometimes for the patients, when I'm in the right spot and they really need it, it kind of hurts a little bit more because they just all of a sudden get a lot more blood flow into that area. But it doesn't always necessarily mean you've hit the spot or not. And what is interesting, with acupuncture is I feel like now that we have more like science and other ways to study it, is that they're able to see when you simulate different points on the body, you actually have different parts of your brain become more active. And so they can see that there's this whole connection there, and that it is actually doing things to the body, or it can help with regulating cortisol levels, and it helps with other hormones.
Yeah, and I mean, when I've been researching kind of the cosmetic acupuncture, and there's the whole acupuncture facelift. I've been asked that over the last several years by many news outlets. And I mean, there are, I think, some real scientific ways to explain how and why it works, even more than that, in that, one of the things I think that you do get, and you mentioned that people fall asleep during the procedure. And by putting the needles in, it's possible that you can get relaxation. You're bringing more blood supply. You can get those muscles in the face relaxed. And what is a treatment that we do that relaxes muscle that smooths wrinkles is Botox. So it's the same idea as there are actually studies that show, even in patients who've actually had temporary paralysis or one-side paralysis of their face, that the area of the body that's more relaxed, that doesn't have the flexing of the muscles necessarily, actually looks smoother and less aged than the part where the muscles are actually actively flexing. And that's kind of how Botox works. So, there's one very scientific but very simple explanation of how acupuncture can work to improve the overall appearance of the face, is you could be relaxing those muscles just like Botox, but you're doing it obviously using a natural way and looking at the meridians and that type of thing. The other thing that I found interesting when I was talking to your husband about this, now Pam's husband is a good friend of mine, Dr. Jerry Bailey, who's also a holistic physician, but I found it interesting because he said, when I asked him, hey, how do you think that this works? What do you think? And this is what you don't even know that we had this conversation.
No, I didn't. Yeah.
And he said, well, I think you put those needles in and you stimulate collagen because you're creating trauma. And, one of the most popular treatments in our practice is microneedling. And microneedling is the idea of you're putting these needles into the skin and you're doing multiple pokes in the skin. And by creating this inflammation, the collagen then will heal into a tighter packed fashion, and the skin will be tighter afterwards. And you can get rejuvenation of even, some of the dark spots going away, the skin feeling tighter, the wrinkles getting better. And it's possible that, you're doing so many treatments, you have to do two treatments a week. And you're doing, you said, for a minimum of 12 treatments. Every needle that goes in is creating scar tissue. It's creating trauma. And scar tissue actually can fill in wrinkles. And we see that with fillers. We'll do fillers in people. And after they do enough time, sometimes we find that the area like the nasolabial folds just fill in and they never actually go away, because not that the filler lasts forever, but that the scar tissue from those multiple treatments, I think, eventually settles in, and now you've got a permanent result. So I think it's absolutely fascinating, because I think there's so many ways that you can describe it. I find actually the Chinese explanation the most fascinating, because it's the part that I understand the least.
Yeah. Well, and I think that's always the hardest. That's the part that a lot of us Westerners have a harder time grasping onto, because it's just a whole different language. I always say it's sort of like trying to learn French or something else, and you just kind of, I don't know but I know we're getting to the same place. We just have different ways of saying it.
Now, do you do these treatments on yourself, or does somebody do it on you?
I can hit a few on myself, but I can't do it all the time, because it's really hard to stand there in the mirror and to get them. My husband also does acupuncture, and so I will have him do some acupuncture for me when I need it, for sure. But definitely trying to treat yourself on your face is a little more challenging.
I remember when I was in college, my mom disappeared for like 2 weeks. I'm like, where did my mom go? I asked my dad, where'd mom go? And he's like, oh, mom went to Korea to learn acupressure and acupuncture. And I was like, what? Oh. So she literally just up and left. She didn't even tell, maybe the day before, she's like, oh, I'll be back. And she leaves. And literally 2 weeks later, she comes back after undergoing this training. And a few days later, I was at home, and she walked into my room with her hand sticking out with literally dozens of needles in her hand. It was, at the time, freaked me out, because I was just a college student. Like, what is she doing? And now she'll do a little acupressure with my kids. If they're sick and we're visiting, then she'll do a little acupressure on their hand and stuff if they've got a headache, or they've got GI stuff. And I do believe it works. I think we know that acupuncture and acupressure works. We just can't really explain it using our means of
Right. Yeah. The Western language, I think, isn't just quite there yet to help to explain it. But you're right. I mean, even probably the place that has a lot of research is actually acupuncture in the fertility world, because there is a lot of research showing acupuncture increasing the rates of fertility, especially when people are doing in vitro or any other assisted reproductive methods. And that's not uncommon to see. A lot of the fertility clinics have acupuncturists on staff now.
Really? Is this something that was being done even thousands of years ago in China, do you know, or is this something that's been more of a more recent trend?
Probably in the past 10 years, because the research has been there. And so actually, I actually have specialized training in this as well, and did a fellowship in Oriental reproductive medicine. And so that's why I'm kind of, in that group where I know a lot of the upcoming research on that. And and it's not been until the past 10 years because people weren't paying attention to it before. But that's where they can show that if you're doing it, twice a week for like 12 weeks, your rates of success increase dramatically just by doing that, and rates of live births. So it definitely works.
And why not? I mean, there's nothing, it's all natural. You're not taking medications, I mean, why not try it? It just makes sense.
Yeah, and you're helping the body get healthier in the process. So
her name is Dr. Pam Langenderfer. She is a naturopathic physician with private practices in Coeur d'Alene, Idaho.
Coeur d'Alene, Idaho.
Coeur d'Alene, yep. Idaho. And Liberty Lake, Washington. Her website, check out thehormonalcode.com. And she'll give is it a free, how does that work? Is there videos that you get, or a newsletter?
There's a video on there people can watch, but they can basically sign up for my newsletter, where they'll get some hormone tips and just natural health news, and be a part of that and learn more.
So that's The Hormonal Code, all one word, thehormonalcode.com. So I'd like to ask you one question before we leave today. If you can give our audience one tip from Dr. Pam. She is a naturopathic physician. She's an acupuncturist. She's also, I know that you're really interested in teaching about hormones and overall health. If you can give one tip for our audience leaving today to kind of take with them, what would that be?
I think my biggest tip is don't underestimate the power of diet. And if you're trying to change your face, if you're trying to change your complexion, if you're trying to change your hormones, the food matters. And especially in Chinese medicine, when you look at somebody's face and their skin, it's an external reflection of what's happening internally. And so by doing things that help to fix it internally, that's how you really create change.
I am 110% with you on that. And that's something that I've tried to as well encourage my patients. It all starts with what you eat. You're so on board, so on topic with that, and I 100% agree. So thank you so much for coming on the show.
Yeah, thank you for having me. I appreciate it.
Yeah, it's been a lot of fun. So once again, Dr. Pam Langenderfer, she's in Idaho and Washington. She's got the website, thehormonalcode.com, if you want to learn more about her. Check her out. She's also on Facebook, where she, what's your Facebook?
Dr. Pamela Langenderfer, and then we also have a Lakeside Holistic Health page as well, so you can find me on both pages.
Great. Well, thank you so much. I'm Dr. Anthony Youn, America's holistic plastic surgeon, and this is the Holistic Plastic Surgery Show. We'll see you next time. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock, and have written all the best of these secrets in this book. This includes the Age Fix Diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.